the gut-to-brain axis and the gut-to-brain axis in health and disease. It's a critical element. It's a bidirectional communication. It's a bidirectional highway for health. So let's break this all down and everything like that. So many people have asked me a lot of questions about the gut. Gut is 80% of your immune cells. It's where your macronutrients and your micronutrients are absorbed. The other thing, when I talk about absorption, a critical element to gut health is actually your ability to absorb food. We forget about that. We talk so much about the immune system, and that's a critical element, but we also forget about that digestion component. I just had 2-3 patients walk in, and we're talking all about digestion, and within that digestion, I was saying your gut health or your gut permeability is compromised. So what things can lead you down a path of compromising your gut? Well, we picked 12 of the more common, 12 of the more popular. Number one, when we look at it's medications. So in those medications, they talk about pain opiates. Now, we all know that we have a pain opiate epidemic. It damages the gut permeability. It damages the villi on top of the gut. Villi are like shaggy carpet. That's actually what it means in Latin. And the villi, moving like this, actually catch a lot of the nutrients and bring it in. So pain opiates are really bad for your intestinal tract. The other type of medications are non-steroid anti-inflammatories, Aleve, Advil, and ibuprofen. They actually damage your intestinal tract. So other than not allowing for any kind of health markers and decreasing any kind of inflammation, pro and anti-inflammation, they damage your gut and they open up the permeability. In addition, they damage what we call the tight junctions. So little quick thing here. Here's your gut. It's what we call like semi-permeable. When it becomes too permeable, things pass the gut. When they pass the gut, they go into your bloodstream and is susceptible to going systemically through your body and causing systemic inflammation. Once they pass your gut and in your bloodstream, we call those an antigen. So when you have an antigen, it means that your body has to respond to it. Your immune system goes on. We call that your adaptive immune system. That adaptive immune system goes on and comes and grabs it with what we call immunoglobulins. And now you get an antigen, antibody, and you get an inflammatory reaction. You get an allergic reaction. So you want to keep our gut in a pristine condition and avoid a lot of these things that we talked about. Whereas that's permeability. Here's your tight junctions. Your tight junctions open up, and that poses an issue also. And in addition, you can damage right through the cell. So the tight junction is called a paracellular damage. Through the cell, it's called a transcellular damage. So markers of leaky gut would be lipopolysaccharide. So there'll be some blood tests that we recommend, lipopolysaccharide. Markers of tight junction damage would be zonulin and occludin and zoin-1. In addition, actomyosin would be a tremendous marker from a protein that's expressed when you have damage to the epithelial cells. In addition, you always typically want to test for IgM, IgA, and IgG. And the reason you want to test for those are natural immunoglobulins implying autoimmunity. So if your gut is compromised, or you're not eating well, or you're taking any of these medications, you're susceptible to autoimmunity. Your body attacking itself. Your body not only attacking itself, but your body attacking specific joints, structures, and the like. Conditions by taking medications can lead you down a path of rheumatoid arthritis, osteoarthritis, brain issues, overload to the liver, leaky gut, leaky heart, musculoskeletal fails, increased incidence of diabetes, blood sugar, weight, thyroid. What a great incidence of thyroid. So with all that being said, medications have a side effect, and you have to understand one of the biggest side effects is damage to the gut. In addition, your gut microbiota composition, so your leveling of good and bad bacteria. Now, we all know we need good bacteria. We have more bacteria in our gut than we have cells in our whole body. So there's good and bad bacteria. The balance is not 50-50. The balance for what we call good to bad bacteria, or gram-positive to gram-negative bacteria, is 85 good and 15 bad. If we go below 85, we unlevel that and we call that dysbiosis. Dysbiosis is an incredible issue because dysbiosis leads you down a negative path, and that negative path is because there'll be bidirectional signaling between the gut and the brain. And that signal from dysbiosis is actually the vagus nerve. And we talked about that last week. In addition, toxic chemicals. Toxic chemicals like chemicals outside, chemicals that you use to clean toothpaste. Triclosan is in toothpaste. 75% of people who were tested for triclosan had leaky gut. Dental floss, toxins from bottles, BPA, phthalates, and the such lead you down a path of damaging your gut's integrity. In addition, undigested food molecules, proteins, yeast, and the such. So it's very critical that your protein gets broken down. It's very critical that as it goes through your intestinal tract, there's not too much permeability to allow these big molecules to come through, starting that cascade of autoimmunity. Inflammatory cytokines. So inflammation. So interestingly enough, cytokines release something called interleukins, which ultimately stimulate the signal transducer of inflammation in your body called NF-kappa B. So I'm not trying to get too technical, but the bottom line with the inflammatory cytokines is when they're released, you have a better incidence, higher incidence of inflammation. Now you can get cytokines from foods, you can get cytokines from breaks in movements, you can get cytokines for a multitude of things. When you have these cytokines, it leads you down a path, again, of inflammation, leading you once again to autoimmunity. Stress. Well, you know what? If we didn't get that microphone in, who knows? I may have had a little stress. Steph's all right. They heard me. It's all good. Stress is a major, whether it be physical stress, mental stress. Physical stress, yes. So people who work out too much, most Americans don't work out enough, but the Americans who work out too much for over 2 hours a day actually put a strain on your gut. So there's a couple of things that I would recommend to help heal that, zinc carnosine and the such. But nevertheless, too much exercise stresses your gut and can lead you down a path of increased gut permeability. Lectins and agglutins, wow. We could spend an hour or two on lectins. Lectins are actually things that bind together. So foods that are high in lectins, tomatoes, beans, and things of that nature, those are two of the bigger ones. Eggplants, so some of the nightshades. So lectins were really documented to be inflammatory in Dr. Gundry's plant paradox, and I think he did a great job. But I think the critical element to know that lectins and agglutins is that in that they can damage the gut, especially if you're allergic to it. If you're allergic to a lectin, there's nothing worse to be allergic to. So understand that they also can cause leaky gut. And a lectin is different than gluten, which we haven't got to yet. A lectin has direct binding to a structure. So it's actually a sniper. So there's lists. Freed has done studies, F-R-E-E-D, on direct binding of lectins. And in those lectins, you'll find out this lectin damages this body part. Food colorings. Food colorings are interesting. You know, your artificial coloring, artificial colorings damage the body and damage the gut. Artificial sweeteners have shown an increase in dysbiosis, therefore increasing people's incidence of dementia and stroke by 3 times. Other things, clearly you guys know I'm going to tell you, gluten. Gluten means glue, sticks to your intestinal tract, causes what we like to refer to as molecular mimicry. Gluten is an issue. No, everybody should be gluten-free. They should be gluten-free. They should be dairy-free. One of the things that in the corner that I like to put up is gums. Guargo gum and all those others, they're sort of the girl with the curl. Some people think they increase short-chain fatty acids. The gums stick. The gum I'm going to talk to you about right now, which is going to blow your mind, is chewing gum. Chewing gum breaks up into too large of a macromolecule and sticks to your intestinal tract and leads you down a path of leaky gut. So when you damage your gut through all these different ideas and a few other items that I mentioned, you get a breakdown of your mucosal IgA and tight junction proteins. We talked about being too permeable, tight junctions, therefore permeability increases. When your permeability increases, you put your adaptive immune system, your B and T cells, on alert, and you start attacking that, and then they dispense out and start attacking different structures, causing you to have a systemic inflammatory increase. You then get intestinal barrier dysfunction. Right at the gut, you're getting barrier dysfunction at the gut. That also poses a health concern. Food allergies and intolerances. So when you get this autoimmunity and everything's on fire and getting attacked, I use the term molecular mimicry. Well, there's a few different terms. Essentially, organs, foods have what we call a protein sequence. It's sort of like a zip code. And in that protein sequence, they're very close. But under the time of stress, the body can't differentiate it, and that's why it starts attacking structures, and that's autoimmunity. That's what rheumatoid arthritis. It attacks the food particle, but the particle in the knee, let's say, the cartilage is so close that it gets confused and it goes. So the zip code, the protein sequence, is very close, and it's molecular mimicry. Now, the great question really is in food allergy and intolerances, did you have a food allergy and it damaged the gut? Or did you have a damaged gut and have a food allergy? So that's why I put up those Cyrex tests, because that's really going to help you determine, it helps me determine which way to go. Got a lot of new tests coming out, a lot of new lab tests coming out, etc. Stay tuned on this channel to find out the leading edge lab tests that you can use for your overall gut permeability, brain permeability, health. In addition, your immune system abnormalities, we kind of talked about that with the autoimmunity. Everything's on alert, and in your body, it's attacking each other. So we want our body to heal itself. As a chiropractor, before we really ventured into functional medicine, we always wanted the body to heal itself. Now that we're doing what I have heard the term functional medicine, I do functional nutrition and personalized nutrition. I mix the biochemical aspects of the body with the mechanical aspects of the body, and I always want to positively affect pathways. We don't want too much autoimmunity. Hence the idea of autoimmunity. So as you go down this path, you damage your gut then sends signals to your brain, and the result is the influence on the blood-brain barrier and neuroautoimmunity. The gut and the brain have the same proteins. The barriers are made up the same thing. So if you have a damaged gut, you have a damaged brain. If you have a damaged brain, you have a damaged gut. When you start damaging the inner leaf of some of the blood-brain proteins and you get something called APOE4, you have a higher incidence of Alzheimer's. So gut to brain and brain to gut are intertwined. So whatever you do, understand that your gut is the center of your universe. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. If there's anything you needed to change today, a takeaway is stop eating gluten, stop adding too much sugar, stop eating dairy, find someone who can help you with your gut health, because you're going to get better brain health and overall health and performance during the day. So do we have any questions, comments, or we are just quiet? I'm pontificating by myself.
Quiet. You just got a shout out from Dr. Ralph Krudelis.
Hey, Dr. Ralph, how are you? So guys, do me a favor, ladies and gentlemen. Please share it, comment on it, ask any questions that you like. We do a Facebook Live every Tuesday. We were just at Integrative Health Symposium over the weekend. We saw Dr. David Perlmutter, Dr. Jeffrey Bland, Dr. Mark Hyman was there, Dr. Josh Axe, Dr. Dane Donahue, and a whole list of others. It was a great event. I was fortunate enough to be able to lecture. We saw the leading edge stuff, where we're going, and everything's pointed towards changing our body and dimming autoimmunity. So with all that being said, it's Dr. Rob, always yours in health.